Hello everyone, this is Felix Konomakis, therapist and admin of the forum. Something that's quite topical lately has been sensory processing disorder, with people saying, I've got the SPD version of this, so, what can I do? And as luck would have it, today I'm seeing Mel, who's soon to be a forum member. By the way, Mel would rather not be on video at the time being, which is understandable. And thank you for this little chat, Mel. So a little bit of background. Mel, we had a session a year ago, and then you saw the videos, and you said to me that, well, in your own words, like the phobic version, the trying. In fact, I'll let you rather than answer for you. So can you tell me the progress before today, and then we'll talk about today?
Yeah. So before I came to you after I came to you last time, I started eating a lot more fruit, a lot more vegetables, trying a lot more things just in general. The fear has been gone, but I thought it was just the sensory side of things and the textures and getting over that. Otherwise, leaps and bounds.
So so thank you for that. And today, working with the sensory processing side, as I mentioned to you at the start of the session, it's a bit of a grey area. There is a spectrum. On one side is some pure biological response to tastes, and on the other side is a purely psychological. And often sensory processing, SPD, is rarely in isolation. It's usually always influenced by some degree of anticipatory anxiety, whether it's 5, 10, 15, 20, 30% or more, we don't know. But the aim of today is to get rid of as much baggage and anticipatory anxiety as possible, allowing you to do a neutral experiment with food. As I said earlier on, if the objective discomfort, difficulty in trying new food is 10 out of 100, what fear can do is inflate it to 90 out of 100, which seems like a big deal. It's what people do, yeah? So if we can reduce the anticipatory anxiety, then food is far more manageable, and then you're really left with the actual sensory experience. But, if you take off 10, 20, 30% fear of that, it's a big deal. So that's the theory. This is how I work with sensory processing. You've tried 3 kinds of foods today. It's all you brought. As I said, if you brought 10 foods, I think you would have tried 10 foods. Can you tell me the difference after we've done a session today for sensory processing side of things, the difference between today and, say, yesterday?
Today I was able to switch off the part of my brain that was saying, just don't, it looks a bit funky, feels a bit funky, don't do it, to just going, right, well, it's something new. Give it a go, and just putting it in my mouth and seeing what it's like.
And make up your mind after the event, not before, because today is all about the preconceptions. So the more baggage we're able to let go of today, the more open you are to doing a neutral experiment, the easier it was. And to your surprise, you ate some dried mango and actually quite liked it. You then ate some dried apricot, didn't like it as much, or not much actually. And then you tried a kind of sort of curry flavored crisp, which is quite spicy, which was okay, and you could do again, which again, statistically, you eat some food, some you like, some are okay, some you won't like. That's how it goes. But, I think it proves today, based on how different you are today than, say, yesterday, if you try those foods, there was some level of anticipatory anxiety distorting your experience of food. Would you say that? Yeah? So that's just how we can help with this method, with anticipatory anxiety, fanning the flames of SPD. So it's not, as I said, it's rarely something in isolation. So, thank you very much for this, Mel. Really appreciate that. I'd really appreciate if you could keep us updated on the forum with your experiments, because this is a very hot topic. It keeps coming around, and that's great. But thanks a lot for today. I really appreciate it.